What's up guys, Dr. Brooks, Dr. John with DSM Spine+Sport, and another Movement Monday video. We're keeping the theme rolling with the low back pain videos, specifically with regards to lumbar spine stability. So last week's video we mentioned about how the low back can become painful when it's missing stability. That stability can be lost due to one of four reasons. So one of those four deficits are being hip mobility, abdominal strength, T-spine mobility, or dynamic neuromuscular control. So last week, Dr. John outlined a great posterior chain link mobilization. This week, we're going to keep rolling with regards to that hip mobility, but attack that anterior chain. Okay. So as we stated, we're talking about that hip mobility, specifically within the anterior chain of the hip. So when I think about losses of anterior chain tissue extensibility function, I typically think about one of two muscle groups, the psoas muscle and then the rectus femoris muscle. The beauty of that is we can attack those two muscle groups kind of with the same mobilization, the same static stretch, with a slightly different nuance. So to clarify here, that psoas muscle is running from the lumbar spine to the front of the hip. That rectus femoris muscle is running from the front of the hip to the top of the knee. So my go-to for attacking those two muscle groups is two derivations of the couch stretch. Okay? So I'm going to jump down here in front of this box and talk about targeting that psoas muscle first. So you'll position a pad and or a towel at home and get yourself in front of a box and or a couch. To isolate and target that psoas muscle, what we want to think about is this concept of being stacked, okay? So my shoulders are stacked on top of my hips, my hip is stacked on top of my knee. Once in that position, I want to think about active glute contraction to roll my hips under and set myself into a posterior pelvic position. That's going to target that psoas muscle because I put that psoas, that lumbar spine, in a stacked position and on stretch. To isolate that rectus femoris muscle, what I need to do is adjust my knee position. So I'm going to readjust the pad and move it in as close to the box as I can get. So I have marked deficits in my rectus femoris length. So this is a really difficult mobilization for me. But what I'm going to try to do is work that knee basically to the corner of that box or really close, and I'm going to be less cognizant about being stacked here, but I do want to think about getting myself upright. But since I'm in such an extended hip position, I'm going to target that rectus femoris muscle more so than that psoas. Once again, we want to talk about timing with regards to these mobilizations. Or we need to think about either pre-workout or post-workout. That pre-workout, I recommend about a 30 to 45 second hold in each one of those positions. So 30 to 45 seconds for that psoas, and then 35 to 45 seconds for that rectus femoris. Post-workout, 2 minutes in each position.